Hi, my name is Christina. I'm a Harper College nursing student. How are you today?
Good, thank you. How are you?
Good. Can you please tell me your name and date of birth?
Yes, February 26, 1993.
Okay, and what's your name?
Ina?
Nina, do you have any allergies?
No.
Okay. I'll ask you a couple of questions. Do you know where you are
Yes, I'm at home.
and why you are here?
Are you doing physical assessment?
And who am I?
You are Christina.
Okay, and what date and month and year is today?
It's
No.
November 19, 2020, it's fall.
Okay, who is the President of the United States?
For now it's Trump, but Joe Biden will be next president.
Okay, and you are awake and alert and you are oriented for times and your speech is clear. And I checked your height and weight before, and your height is 5'6" and your weight is 132 pounds. Your BMI is 21.3, which is normal. And I checked your vital signs, blood pressure, heart rate, respiratory rate, and temperature. They are within normal limits. And also I'll check your vision acuity. I'll check your nerve number 2 for intactness. And for that I'll use Snellen chart 20 feet away, and you'll cover one eye and close your one eye and just read with one eye and then switch. Okay? And I can see that your skin color is appropriate for the ethnicity. And I will start by taking a look at your head. Is oval, is the shape is appropriate, and the size for your body is normal cephalic. I'm going to palpate your scalp. Let me know if you feel any pain, okay?
No.
And I don't feel any lumps or masses, and I also check for infestation. And the hair is clean and shiny. No infestation present. And next I'm going to check the symmetry of your face. I'm looking at your eyebrows, eyelids, nasopharyngeal folds, and the margins of your mouth. Everything looks symmetrical. And can you smile for me? And can you frown? Okay, so cranial nerve number 7 is intact. Okay, next I'm going to check your vision acuity, your cranial nerve number 3, 4, and 6 for intactness. Okay, so I have this pen, you just follow the tip of the pen, okay?
Mm-hmm.
And I check for the accommodation, you follow the tip again, I'll bring it towards your nose. And the pupils are constricting and coming together. Okay. Next, I'm going to check the pupillary light reflex. So pupils are equal, round, and reactive to light and accommodation. I'm going to check your sclera and conjunctiva. Sclera is white, conjunctiva is pink. And I move forward to check your temporomandibular joint. Can you open your mouth? Do you feel any pain? And I also didn't hear any crepitism or clicking. And I will palpate your maxillary sinuses. Any pain?
No.
And frontal sinuses?
No pain.
Okay, and take a look at your nose. Is at the midline. Septum is at the midline as well. I'll palpate it. Do you feel any discomfort?
No.
Okay. Check the nostril patency. Can you cover one nostril and breathe to the other and do the same thing? Any discomfort with that?
No.
Okay, that's good. Next, I'm going to palpate your ears. They are symmetrical. I don't feel any lumps. I don't see any lesions. And I don't see any serum present. Did you feel any pain with that?
No.
I'm going to check your cranial nerve number 8 intactness. I'll whisper you something and you say it back to me, okay?
Mm-hmm.
Fall semester almost over.
Fall semester almost over.
Okay.
Yeah.
Beautiful plants.
Beautiful plants.
Okay. Thank you. Next, I move forward to check your mouth. I can see that your lips are pink and moist. And I'll ask you to open your mouth. Your teeth are white and all are present, and the gums are intact. I'm going to put on gloves and check the hard palate, soft palate, tongue. tonsils and uvula. I'll just touch with my finger,
Mhm.
okay? So I need light to see. Okay, open wide. Okay. Can you bring your tip of the tongue up? Okay, stick your tongue out. Okay, good, thank you. So your dorsal part of the tongue is white, pink, white and rough. Bless you.
Thank you.
And underneath your tongue is pink and shiny. Your buccal mucosa is intact. And can you say, open your mouth and say, ah? Okay, uvula and tonsils pink and intact, no inflammation present. And next I'm going to palpate and check your glands for any inflammation. Check the parotid gland and salivary gland. And at the base of the neck, the thyroid gland. No inflammation present. And I'm going to check the lymph nodes, okay? I'll press, let me know if you feel any discomfort. Preauricular lymph nodes, postauricular, occipital, submental, submandibular, jugular digastric, superficial cervical chain, deep cervical chain, posterior cervical chain, and then the supraclavicular. Can you shrug your shoulders? Okay, good. No abnormalities found. And next I'm going to check the intactness of cranial nerve number 11. Can you shrug your shoulders and press against my hand, against the other? Okay, thank you. And next I'm going to palpate your carotid pulses, okay?
Mm-hmm.
Okay. Strength is 2+, rhythm is regular, and rate is within normal limits. And I also going to auscultate with the bell of my stethoscope. And for that I'll ask you to breathe in, breathe out and hold, okay? Again, breathe in, out and hold. Okay, thank you. No abnormal sounds or bruit present. Next I'm going to inspect your upper extremities. I take a look at your arms. I don't see any lesions present, bruises, pallor, redness, and I check the temperature. Your skin is warm and no edema present. And I also check your radial pulses. They are symmetrical, regular, strength is 2+, rhythm is regular, and rate is within normal limits. And I'm going to check your fingernails for capillary refill. And I can see that the capillary refill is less than 2 seconds. The nail beds are pink, and the nails are firm. I'll check the profile sign for each nail. It's less than 160 degrees, which is normal, no clubbing present. Okay, so I'm going to check the strength in your arms. Can you bring your arms up on your back? Okay, put your hands like this. Bring them up. Put your fingers like this. Okay, pull towards you. Okay, press against my hands. Okay, squeeze my fingers. Okay, thank you. And then I'll check your elbow strength. Can you put your arms like this? Okay, pull towards you. Press against my hands. Okay, good. And next I'm going to move to inspect your chest. Your chest is symmetrical in front, normal respiration movements, symmetrical in the back, no abnormal movement, no palpitation. I'm going to listen to your lungs, okay? And you breathe deeper than normally, okay? Through your mouth. I'm also going to auscultate in your back. Okay, so I could hear the bronchial sounds up here, bronchivesicular in the middle, and at the base of the lungs, vesicular breath sounds. And next I'm going to auscultate your lobes. Can you lift your arm up? Okay, so I have to auscultate like 2 lobes on the left side. Breathe deeper. Thank you. And then 3 lobes on the right side. Okay, thank you. Next I will check your jugular vein, and for that I need 30 to 45 degree profile, so can you lie down for me and move your head on one side. No jugular vein distension, can you look towards me? Again, no jugular vein distension. Okay, thank you. You come up. And I'm going to listen to your heart for 1 minute, okay?
Mm.
I'm going to touch your breast.
Okay.
Okay, rhythm is regular and rate is between normal limits. I'm going to auscultate your 4 valves. Okay, first to the diaphragm of my stethoscope. The aortic valve, pulmonic valve. I'm going to touch your breast again. Tricuspid valve, mitral valve, and tricuspid. No abnormal sounds present, and I'm going to auscultate with the bell of my stethoscope. Aortic valve, pulmonic, mitral, and tricuspid. No murmurs or abnormal sounds present, and I did here the S1 and S2. Okay, next I'm going to ask you to lie down. Thank you. I will inspect your abdomen. I check the contour. Your abdomen is flat and the symmetry. The abdomen is symmetrical, and I don't see any incisions or lesions or any abnormal color present. And I don't see any abnormal movements except respiration movements. I'm going to use the diaphragm of my stethoscope and listen in all 4 quadrants for valve sound, okay? I can hear normal valve sounds. And with the bell of my stethoscope, I'm going to listen to the aorta and the renal arteries, okay?
Mm-hmm.
The aorta is 2 inch up your umbilicus. And the renal arteries are on the sides, 2 inches. No abnormal sounds, no bruits. Okay, thank you. Next I'm going to palpate it, okay? Let me know if you feel any tenderness or pain. Okay, I'm going to use deeper palpation, okay?
Mm-hmm.
Any pain or discomfort?
No.
When was your last bowel movement?
Yesterday evening.
Okay, do you usually go normally?
Mm-hmm.
Okay, that's good. Thank you. Nothing abnormal present. Okay, you can come up. Or actually sit like this. I'm going to inspect your lower extremities. And again, I don't see any lesions, any abnormal color. Check the temperature. Skin is warm. I don't see any varicose veins. And I check the hair distribution. I don't see hair. Do you shave?
Yes.
Okay. And next I'm going to check the capillary refill in the toes. It's less than 2 seconds. I'll check for the pretibial edema. No edema present. I'll check the dorsal pulses. They are equal. Rhythm is regular and the rate is within normal limits. And I'm going to check the strength in your legs. Can you lift your leg up? One leg. Keep it for 5 seconds. Okay, and then the other. Okay, good. Bring it on a side. Good. Bring it in. The other one on a side. In. Okay, I'm going to check again range of motion. Bring this in, out, and then the other leg. In, out. Okay, and then check the dorsiflexion. Can you pull against my hands and press against my hands? Okay, good. Can you come up at the edge of the... Actually, stay like this. I'm going to check your Babinski reflex since you're up, okay?
Okay.
Okay. A little bit of reaction, which is normal, or no reaction will also be normal. Okay, thank you. You can come up. And I will check the strength in your knees, okay?
Mm-hmm.
Can you press against my hands and pull against my hands? Good. And next I'm going to do the sensory check. I'll ask you to close your eyes. I'm going to touch you and say now when you feel the touch, okay?
Okay. No. 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 No.
And next I'm going to check the sharp and dull discrimination. This will be dull and this is sharp, okay?
Okay.
Close your eyes and let me know what you feel.
Dull. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp.
Good. Okay. Next I'm going to check the bicep reflex. Make a muscle for me. I'm holding the tendon and okay, good. And the other, make a muscle for me. Going to press. Okay, good job. And next, relax your legs and I'm going to check the quadriceps reflexes, okay? Good. Good job. Next, I'll check your gait. Can you stand up and walk in one direction normally? And then walk backwards like heel to toe. Good job. And then stay still. And with closed eyes and feet together. Don't move for 20 seconds. Okay, Romberg test is negative. You can have a seat. Also for cerebral function, you have to do like heel to shin. Okay, good. That's good. And then come up. I'm going to inspect your spine. I can see that the scapula, hips, and gluteal folds are symmetrical. Your spine is at the midline. Can you bend forward? Okay, thank you. I can see that the thoracic spine is convex and the lumbar spine is concave, which is normal. I'm going to check the range of motion in your spine. And just don't move your hips, just move your torso in one direction. Good, and then the other. Okay, perfect. And that concludes our physical assessment. Thank you.